How can I treat the dark circles under my eyes? Can you give me some ways to treat my eyes?
Thank you for your question. You've submitted several photos and you're asking a simple question. What do you do about dark circles? Well, at this point, there are a lot more options than what we used to have many years ago. I've been a practicing cosmetic oculofacial plastic surgeon for over 20 years, and I can tell you that for many years we were always frustrated because a lot of times the dark circles under the eyes could not be managed with anything more than some kind of attempt to try to lighten them with bleaching creams or some type of other external treatment. Move the clock forward, and in our practice we've developed our own process for addressing dark circles based on first defining what the cause of the dark circles are. So in your situation, I would say that the dark circles are the result of an area of hollowing called the tear trough. And this is a very common area that people are concerned about, that it causes this the crevice or this depth that makes the eyes look like they're tired and there's hollowing. In addition, when the skin is relatively thin, you're practically seeing directly to the bone or seeing right through it towards the muscle. Eyelid skin is the thinnest skin in the body, and with this 0.5 millimeter of thickness, anything below the eyelid skin is almost transparent with the right anatomic factors. That includes light skin and very little thickness in the tissue. Now, for someone like yourself, we've had a lot of success using a combination treatment. And the combination treatment is based on two concepts. One is addressing skin quality. Skin quality under the eyes can be improved using a material we use commonly called platelet-rich plasma. Platelet-rich plasma is actually the growth factors and the healing factors derived from your own blood. And what we do is we do a blood draw like you would at a lab or a doctor's office, and we spin the blood and we concentrate the platelet-rich plasma, and these healing factors stimulate collagen, blood supply, and improve the skin quality in a way that improves the thickness and the overall healthy appearance of the skin. So that addresses the skin quality part of the equation. The second part, the very important part, is the volume. And with volume, what we use is a hyaluronic acid filler, such as Restylane. Now, what we do very differently is there's always an art to doing this, and placement and the viscosity of the hyaluronic acid is critically important. So what we've been able to successfully do is combine the hyaluronic acid filler to fill the tear trough with platelet-rich plasma to improve skin quality. It's been well documented in medical studies on wound healing that there's actually a synergy when combining platelet-rich plasma with hyaluronic acid so that wounds would actually heal better in combination. We have observed the same thing in our practice in that this combination helps make the under eye area look a lot better. Now, what is a challenge here is, of course, not only the placement and getting the results that you desire, but also maintenance. The hyaluronic acid will break down and eventually disappear. There is some evidence of some residual fibrovascular or tissue that actually is there for the longer term, but nonetheless, the bulk of the hyaluronic acid volume effect does require some maintenance. What I've observed since the first FDA approval of hyaluronic acid, I believe back in '05, is that there's actually a variability in how long it lasts between individuals. And certain factors can certainly cause an acceleration in the degradation, such as cigarette smoking. If someone smokes, they tend to break everything down because between the carbon monoxide and the free radicals and everything else that's so damaging, it can cause a breakdown of the material. So we always observe our patients very closely. We routinely do this first treatment, and then we see our patients 2 weeks later to make sure everything looks right. And then we'll see people on a regular basis so that we can see when the material breaks down. It has not been unusual for a patient to come in every 6 months to have it done, and there have been patients where it's lasted up to 2 years. So I think that for your situation, a combination approach is exactly what we would do in our practice, would be to use hyaluronic acid and platelet-rich plasma. Now, what I also didn't mention is that there is a role for external topicals, such as retinols and really good quality moisturizers. Everything actually contributes, and I always say the whole is greater than the sum of the parts. And so this is kind of like just putting all the parts together in the right way to get the maximal result. So at this point, I think it's advisable for you to meet with experienced and qualified specialists who do a lot of work in this under eye area. There's a lot of gimmicks lately about trying to improve the dark circles, and a lot of them have to do with topical creams, and a lot of them have to do with various differentiations that certain doctors use, such as use of blunt cannulas and other things that make it seem like there's a superiority there. But the reality is, the key is really knowing the anatomy and knowing how to do this and having the experience to formulate this combination in the most effective way. And that comes from just doing this a lot. And so with that being said, just meet with doctors and see if you're comfortable and try this solution. It's a relatively low risk solution since there isn't a surgery or a permanent implant or anything of that nature. So I hope that was helpful. I wish you the best of luck, and thank you for your question.